What are the 10 different types of miscarriages? Hi, I'm Dr. Samantha with Walk the Naturopath. I'm a natural fertility doctor, and today we're going to talk about different types of miscarriages. So, we know miscarriage overall is a pregnancy loss. What a lot of people don't know are that there are actually different types of miscarriage or different types of loss. Before we get started though, I just want to say if you're watching this, I'm assuming you've gone through a loss yourself, and I would just like to say that I am sending you so much love. My heart goes out to you, and I know that no matter what type of miscarriage you have had, that can be really, really difficult, and I just want to say that someone is thinking of you. Usually after a loss, I do get patients ask me like, what should I do? Honestly, my biggest recommendation is going to be try to take care of yourself the best way that you can. What does that mean? It usually means starting with your heart, right? There is grief involved in having a loss, and this is a really hard topic. And I just usually say, give yourself some time to grieve, to let yourself heal. I do understand that part of you may never heal. I know a lot of my patients have just shared a lot of their stories with me, and they've educated me on how miscarriage can truly impact a life. And so again, just sending lots of love. And if this has happened to you, or if you know someone that this has happened to, I'm just going to say, just shower them or yourself with love and make sure to just kind of put yourself first for the next few weeks, few months. Let's first talk about different types of miscarriages, and then I think I'm going to make a video later on about what are causes of specific types of miscarriages. This information can get really long and overwhelming, so I think separating it into two videos is going to be the most ideal. So here we go. The first types that we are going to be talking about are the timing. So they're the first 4 types, and they have to do with timing of the loss. So the first miscarriage is an early miscarriage. That's usually before 13 weeks, so essentially a loss within the first trimester. The second type is going to be a late miscarriage. That's usually any miscarriage after 13 weeks. Third type of miscarriage is going to be a clinical miscarriage. This one's usually between 5.5 weeks and 6 weeks. Usually you can see something in an ultrasound at this point, whether that's an embryo or a blighted ovum. Essentially that just means like egg and sperm fused together, but an embryo was not developing. You'd normally see something upon the ultrasound, but then loss does occur pretty early on. And the fourth type of miscarriage for the timing piece is going to be a biochemical miscarriage. Biochemical miscarriages usually happen between 4 weeks and 5 weeks. They tend to be overlooked just because, one, a lot of times people don't take a pregnancy test that early. They're usually waiting until they miss their period. Some people do miss their period by a day, and then they take a pregnancy test and it's saying it's positive, and then all of a sudden their period will come that day or the next day. They're very close timing-wise with your period. So they can be missed very, very often. A lot of people are told that these aren't necessarily a real miscarriage. I completely disagree with that. It is a miscarriage. It is a loss. HCG was picked up on a pregnancy test. A lot of times if you get a blood test, it will also show it is a loss, and they're grieved the same way. If someone ever tells you that, please don't be like, oh, it was so early on, that's barely a loss. It's a loss. And for those who are trying to conceive, it's really difficult. So be mindful of that. The next 6 types of miscarriage are more about what's going on in your body. The 5th one is going to be a threatened miscarriage. What does that mean? This means there could be some spotting in early pregnancy in that first trimester, and it's threatened because that's not ideal. However, with that being said, a lot of women actually do experience spotting and some bleeding within the first trimester, and everything ends up being completely normal and completely fine. Usually they just encourage people to go in and get ultrasounds to make sure that everything is good to go and there's not too much bleeding. The next one is a missed miscarriage. So what does that mean? It basically means that a miscarriage occurred usually earlier, around 6 weeks or 5 weeks, and it was missed because the body didn't show any specific signs. There was no bleeding, there was no cramping. Your body wasn't receiving the signals saying, hey, this embryo is no longer viable. A lot of times this is picked up in an ultrasound. So usually they're doing an ultrasound, and unfortunately there's that really hard period of time where, you know, the tech or the doc will have to say, I'm not seeing a heartbeat, or it looks like baby is not growing on track. A lot of times they're technically at their 8-week appointment, but baby size looks around 6 weeks in development, so that can be really difficult. The body can still process this loss naturally. However, many people tend to opt for either medications or further assistance in the miscarriage. The next one is an inevitable miscarriage. Basically, there's just some signs that are pointing to that there is going to be a miscarriage. The eighth one is a complete miscarriage, and that's where your body gets all the signs and expels the tissue completely, and there's no assistance needed, either medications or surgical. Number 9 is septic miscarriage. This one is really emergent. It's just telling me that there is probably a bacterial infection and this needs to be treated right away. So that is something that you do go in and get medical care for as soon as you know that's happening. Usually you'll experience very clear signs and symptoms, and once you tell your doctor about them, they will encourage you to come in. And then number 10 would be recurrent miscarriage or recurrent pregnancy loss. This has now been updated within the last few years. To diagnose someone with recurrent pregnancy loss or recurrent miscarriage, the coding required at least 3 losses. Now it's 2, and any type of miscarriage is part of that. So even if there's 3 biochemical miscarriages or a chemical miscarriage, that is defined as recurrent pregnancy loss. So ultimately, those are the basics of each type of miscarriage. Again, this is a really difficult subject, and I feel for you if there was some emotions arise through this video. I'm usually really smiley and bubbly, but this is just not a topic to be that way about. So here I am in just a different form today. But I do hope you learned something new. For those who have gone through loss, I always want to reiterate that it's not your fault. You are not broken, and I am sending all of you so much love. A lot of times in the conventional world, they'll usually just tell you that most miscarriages are genetic related, and that's so true. It's usually an abnormal chromosome, and that is just something that happens very commonly. I didn't talk about this earlier, but the rate for miscarriage is 1 in 4 pregnancies, so it is a very common thing, and there might be absolutely nothing wrong or any root cause, but it's just sometimes they happen, sometimes losses occur. With that being said, from the naturopathic side, 1, I do agree with that, but I also agree that there is a certain amount that you can take into your own hands. What does that mean? We make sure that all things are taken care of and evaluated, and that would be by treating the root cause. Finding those root cause can also differ depending on where the loss occurs. So that's going to be the other video that I make later on, because I do think this is really important to go over, and I think it's something that's good to understand. But you can work towards optimal with certain root causes, and so that is going to be something that I'm going to encourage people look into and try to discover, because at the end of the day, it's not all in your control, and like I said, nothing is wrong with you, but sometimes we can do more than we ever even realize by treating root causes, making sure our thyroid's good, our gut health's good, micronutrients are good, our reproductive hormones are good, we have no clotting disorders, and so on. So I just wanted to place that little seed to start that thought process, and again, I'm just here to say, I'm sending you so much love. I know I've said that a million times, but I do really want you to know that and feel it from me. And I hope you learned something new today, and I hope you have a beautiful rest of your day.